Multidisciplinary communication is a fundamental aspect of contemporary nursing practice and involves a process of reporting, collaborating, and conveying with various members of the healthcare team in order to translate information, instructions, or certain patient requirements. This process can be done verbally or through documentation and is used in all situations throughout each patient's hospital journey, such as medication orders, risk assessments, treatment planning, surgical approaches, and countless more, in turn highlighting its importance in providing the scaffolding that enables a healthy team environment and pushes for a joint effort towards the overall goal of optimal and safe patient care. Effective patient care often requires input from various specialist staff from the multidisciplinary team, and with over 11 million patient admissions into Australian hospitals each year requiring treatment from physicians, physiotherapists, dietitians, nursing staff, social workers, or psychiatrists and specialist staff, it is intrinsically crucial to have a foundational approach to coherent and collaborative communication techniques in order to ensure safe practice is achieved. A widespread survey among 244 hospitals found the main barriers to effective communication between the healthcare team to be the perception of power and hierarchical dominance, differences or lack of basic communication training, lack of respect, time pressures, poor compliance with communication methods, and a low confidence in junior staff members. This creates a problem when finding effective patient care, as insufficient communication between the multidisciplinary team can cause confusion, lack of coherence to a care plan, medication errors, and commonly lead to mistakes and inadvertently patient harm. 66% of adverse events are as a result of communication failures between healthcare professionals. Communication between the allied health team is a fundamental aspect of providing any patient care and is used in numerous situations, from exchanging crucial and time-critical information in an acute situation to planning a safe discharge for a patient who requires ongoing community assistance. Failure to ensure adequate communication techniques has proven to be detrimental to a patient's treatment journey, as demonstrated when looking at the 2004 Commission of the Australian Healthcare System, which found that the underlying issue of 2,455 harmful or unsafe patient situations and adverse events such as medication errors, patient falls, increased admission times, and infection was inadequate communication between the healthcare team. The concept of team communication has a large contribution to building a healthy workplace, as it works to build rapport amongst co-workers while also pushing for a level of trust and respect between individuals as they gain an appreciation of collaborated ideas. A 2017 systematic review of Australian healthcare teams highlighted aspects such as increased staff retention, improved morale, team empowerment, and innovation as positive outcomes of strong communication techniques amongst the multifaceted specialties which make up the primary healthcare team. While high turnover rates, increased staff absences, lack of coordination and cooperation, and low morale were demonstrated as negative effects which presented when poor multidisciplinary communication occurred in a hierarchical team environment. A 2014 systematic review works to further demonstrate this link through exploring the benefits of adequate communication and a multidisciplinary care approach to treatment, highlighted an increase in patient satisfaction and an overall decrease in the number of adverse events as a result of coherent and collaborative care, which modeled a positive team environment and strong communication techniques. Nurses are at the front line of everyday patient care and accumulate the highest amount of patient interaction, in turn making the information in which they gain pivotal for providing individualized patient care and demonstrating the everyday need for multidisciplinary communication in contemporary nursing practice. The use of these techniques in nursing practice is further evident when looking at critical care environments such as the emergency department, intensive care unit, or operating theatres, where nurses work with a large team of specialized staff from different fields in a collaborative effort to treat patients, and are required to discuss assessment findings and patient data with the team in a competent manner. In turn, this concept plays a major part in everyday nursing practice and can be seen in all areas of the hospital, in situations such as clinical reviews, patient assessments, team meetings, and handovers, with nurses in Australia completing an estimated 40 million clinical handovers each year as they convey vital information to multiple members of the multidisciplinary team, in turn highlighting the issue as a major aspect of contemporary nursing practice. Multidisciplinary communication and a healthy team environment come hand in hand. In turn, the same principles apply in promoting their success. These principles include mutual trust, appreciation and respect, equal contribution, common goals, and a collaborative approach to care. In order to achieve these principles, various communication techniques have been employed by Australian hospitals, such as the ISBAR and PACE communication methods. ISBAR creates concise handover scaffolding in an attempt to maximize communication efficiency and involves the principles of introduction, situation, background, assessment, and recommendation as primary factors when exchanging patient information to another healthcare member. A 2017 systematic review looking at the efficiency of this method between nurses and physicians found an overall improvement of handover communication as 74% after the introduction of ISBAR, while barriers to success were explained as dominance of power and a lack of confidence in challenging orders. Another communication tool which is currently being used to overcome the problem of inadequate multidisciplinary communication is the acronym known as PACE, which promotes the techniques of probe, alert, challenging, and emergency in order for nurses or healthcare professionals to voice their concerns and appropriately escalate patients' needs to the necessary individuals. The use of PACE has proven to be instrumental in patient advocacy as it provides a tool to engage treating clinicians in a conversation about a chosen treatment while working to remove the potential for miscommunication. A 2016 survey targeting healthcare teams after the introduction of the PACE methodology in 3 hospitals found its use to be overwhelmingly beneficial, with 75% of participants stating that it created a platform for multidisciplinary communication and an appropriate approach to challenge an area of concern. Concept of clinical leadership involves the use of innovation, motivation, and support in aim to encourage participation towards a shared goal, and in turn has the potential to play a large role in pushing for change within the healthcare system. A 2011 systematic review found that through positive and innovative nursing leaders, there is a monumental potential to create a positive workplace culture and enhance communication between the multidisciplinary team. The study found that through the use of encouragement and role modeling behaviors, nurse leaders were able to create a cohesive environment that valued trust and respect between members, in turn creating a space for comprehensive and open collaboration between the team. A 2014 qualitative study looking at the transition of new graduate nurses into acute care tertiary hospitals found the attributes of confidence, prepared knowledge, active participation, evolution of skills, and adherence to communication policies to be largely beneficial to a new graduate nurse when transitioning to the registered nurse position. The study found that new graduate nurses who portrayed these skills were 67% more likely to feel accepted by the multidisciplinary team and was shown to play a beneficial contribution to a collaborative environment, while new graduate nurses who lacked confidence and were unfamiliar with adequate communication techniques were shown to have a higher turnover rate and problems combining with the workplace culture. As a new graduate nurse, it is important to work within your scope of practice in order to adhere to legal and ethical boundaries and to ensure best practice and optimal patient care. This includes working in accordance with the nursing and midwifery standards of practice, as well as the Code of Conduct for Nurses. Standard 2 directly links to this issue and states that as a registered nurse, you must engage in therapeutic and professional relationships and to communicate effectively and respectfully with colleagues, while also collaborating in or leading collaborative practice. The Code of Conduct for Registered Nurses also aims to address this issue through Principle 3.3, which looks at effective communication and ensuring there is clear, accurate, relevant, and timely exchange of information between healthcare professionals. Through adhering to each of these standards, there is an increased opportunity to build rapport with colleagues and, in turn, a lessened potential for miscommunication. This presentation utilizes auditory learning as the primary channel of learning, which is proven to result in increased retention of information, in turn allowing for viewers to gain a better understanding of the issues and solutions which were conveyed. While the use of key terms and summarization throughout the PowerPoint allows for the audience to gather the significant concepts being raised in a clear and concise version, rather than reading large amounts of information to find the necessary messages. The use of current policies and peer-reviewed literature has also proven beneficial in engaging the audience with recent data and real-life statistics that prove the relevancy and legitimacy of arguments and concepts which are being conveyed. This presentation will equip clinical leaders with the knowledge of possible responsibilities and attributes in order to engage in the skill of multidisciplinary communication, while highlighting current methods and relevant data which reinforces ways in which to mitigate the issue. The presentation also highlights important legal and ethical standards, which a clinical leader will aim to role model within their practice. Through the use of summarization and highlighting key terms, while also learning through an audio aid, the audience is encouraged to actively respond and contribute to a collaborative workplace environment that values communication techniques in order to ensure patient safety.